One of the many issues affecting adolescents are eating disorders. An eating disorder is a severe disturbance in one's eating patterns and behaviors, as well as their thoughts and emotions. Eating disorders can take many shapes and many forms and gravely affect an adolescent's physical, mental, and emotional health. Some quick stats surrounding eating disorders are roughly about 3% of adolescents between the ages of 13 and 18 are diagnosed with an eating disorder in their life. Although anybody can be affected by an eating disorder, generally, adolescent girls are more susceptible to EDs than boys. Factors such as a family history of eating disorders, substance abuse, and negative childhood events such as child abuse, a death in the family, or even a divorce can increase this risk. The severity and legitimacy of eating disorders are often undermined and vilified due to innumerable misunderstandings projected by the media and the general public. Some of the many myths may include eating disorders only affect women. This is very false because men of all ages, backgrounds, and sexualities are susceptible to EDs. In fact, 25% of people with eating disorders are men. Toxic masculinity and macho culture often deter men from seeking health because many men believe eating disorders only affect certain types of men, specific types of men, and thus this deters them from seeking help, and this is very detrimental to their health because it could lead to death. And so organizations were created to encourage men to seek help, and one of those organizations is the Men Get Eating Disorders Too, which is a UK charity group that works towards gender-inclusive services and attitudes in eating disorders. Another myth is eating disorders are not a real disease, and this myth parallels one of the many attitudes towards depression that's it's not a real disease, that it's something that people could just snap out of, when in fact eating disorders impact brain functions, and the brain, while during a eating disorder the brain doesn't function normally, the brain structure is affected greatly, and EDs reduce gray matter levels in the brain, and self-perception becomes heavily distorted. Another myth is you must be skinny to have an eating disorder. Not all people who suffer from eating disorders lose a significant amount of weight. In fact, 64% of patients with bulimia nervosa were classified as overweight, and 36% of patients with bulimia nervosa were classified as normal weight. And binge eating disorder patients often seek help for overweight and losing weight. One of the main eating disorders is bulimia nervosa, and the signs and symptoms include weight loss, food intake, and dieting become central focus. The patient may suffer from binge eating. They also might experience purging, and they'll disappear after meals, and signs of vomiting or laxative and diuretic use are present, and adolescents may use laxatives and diuretics to just remove any food or any drinks from their systems and lose weight as easily as possible. Excessive water consumption and bloating from liquid retention, because drinking cold water often kind of kills an appetite. Adolescents may do this to just stop themselves from eating. As I mentioned before, their weight just becomes their central focus, and this will cause them to exercise excessively and have rigid exercise regimens. They could hide their body, and they could always be in baggy clothes and whatnot. And now, behavioral and physical effects include chemical imbalances, which can lead to organ failure. And as I said earlier, this parallels one of the effects of depression. Bulimia nervosa can also cause cardiac arrest as well as depression. Causes and risks and factors, they're often unknown, but they could be pinned down to genetic, biological, environmental, and societal, and emotional. Now, genetic, as I mentioned before, if eating disorders run through the family, an adolescent may be susceptible to that. And environmental, societal, as we see in the media, there's often stigmas and images as to what somebody's body should look like, and this could affect an adolescent's self-perception and lead them to suffering from an eating disorder. Who's more prone? And as I mentioned before, anybody can get affected by an eating disorder, although girls and women are more likely to experience bulimia nervosa. And it's most likely to begin and occur during late teens and early adulthood. A way to prevent bulimia nervosa includes promoting healthy body image, encouraging healthy eating habits, and enjoying family meals together.